It's now recording.
Ready?
Yeah.
Okay, so for our community-based project, we chose coccidiomycosis, which is also known as valley fever. On our next slide, you're going to see our objectives for this project. Go ahead and go to the next slide. So we're going to learn about coccidiomycosis. We're going to learn how it's transmitted, as well as the groups that are at risk for getting the disease. We'll also learn signs and symptoms and preventative measures, as well as healthcare treatment. So what is coccidiomycosis? It's a fungi. The name for it, or the organism name for it, is Coccidius. Its names can be referred to as coccidiomycosis, San Joaquin Valley fever, or desert rheumatism. And then we have the reservoir and transmission on this slide. For reservoir, it's soil. And you can see on the right side, there's a map of the United States, and the lower or the southwest portion of the United States is all red. This represents kind of the highly endemic areas for this type of organism. You see that it's prevalent in the southwest United States. There's also parts of Mexico, as well as South America. Mainly high endemic areas that relate to us would be the California San Joaquin Valley. So that's where we live. And then also like states like Southern Arizona. On the bottom of that map picture, you can see here the transmission. So valley fever is spread through an infection of fungal spores. What basically happens is when you disrupt the soil, the soil gets into the air, and then you inhale the airborne fungal spores. And then the spores, once you inhale them into your body, you're gonna infect your lungs. And then some severe cases of coccidiomycosis is it will infect your lungs and then disseminate to other organs. So once the fungal spores spread to the other organs of your body, that's when coccidiomycosis becomes very severe for most patients. And then our next slide shows risk factors. So some common risk groups would be, of course, patients that have weakened immune systems, like patients who have HIV or AIDS, those who get organ transplants, pregnant women, diabetic patients. And then there's also research that has shown that certain ethnicities, particularly African American and Filipino ethnicities, have a higher risk for a coccidiomycosis disease. And then some common signs, usually signs of the infection appear between 1 and 3 weeks of inhalation of fungal spores. And then, like I mentioned previously, severe cases, there's 5 to 10% long-term problems for patients who get coccidiomycosis in their lungs. And then there's also the 1% of infection that spreads from the lungs to the other organs, also known as disseminated coccidiomycosis.
All right, so we're gonna go ahead and talk about some symptoms, signs and symptoms. So some symptoms are like flu-like or none at all. Some symptoms also include fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches, or joint pain. You can also see some rash on upper body or legs. Symptoms usually last a few weeks to months, depending on how severe one has for the disease. All right, so now we're going to talk about a case. I did my evidence-based paper. I did a research, and a case was presented in the article on my research that a 64-year-old female patient had signs and symptoms of cough, chest pain, shortness of breath, wheezing, and fatigue that lasted for a month. So the female patient did not fall into any risk categories for coccidiomycosis, and she didn't live in an agricultural community, but she did live in Fresno County, where the area was surrounded by agricultural farmland. So she went to go to the urgent care. A diagnostic test included a CBC and a chest x-ray. The chest x-ray showed right lobular infiltrate. She was prescribed azithromycin, but her symptoms continued. She then returned 2 weeks later to her primary care physician and was given doxycycline and prednisone, but there was no signs of fever. In addition, her symptoms did not go away, and later on, she was then diagnosed with coccidiomycosis. So go ahead, next slide. So here are some ways that on my research article that ways recognizing and managing coccidiomycosis. So how physicians should, since she was so when one does present symptoms of coccidiomycosis, make sure to maybe get seen by a healthcare provider so they can be appropriately diagnosed and treated right away. And then when a healthcare provider gets a patient, they should consider that valley fever is a diagnosis, since that female patient was diagnosed later on. So they could have caught that that disease right away, but since she was misdiagnosed, she didn't get treated right away. So the right test should be ordered, risk factors should be checked, complications that are presented, and the patient should be referred to a pulmonologist right away. When diagnosed, it is recommended that a follow-up with a clinic should be done every 2 to 3 months to monitor the disease so it doesn't worsen.
Alrighty, so we're going to talk about coccidiomycosis in our community. So according to the California Department of Public Health, they announced that about 9,004 reported new cases of valley fever in California in 2019, the highest number since the state started tracking cases in 1995. While reasons for this record level are not clear, the above average level of rainfall during the 2018 and 2019 winter might have contributed. Consistent with previous years, the highest incidence of valley fever in 2019 was reported in counties in the Center Valley and Central Coast regions of California, including Kern, Kings, San Luis Obispo, Fresno, Tulare, Madera, and Monterey counties. While anyone can get valley fever, those most at risk for severe diseases include people who are Black or Filipino, adults 60 years or older, pregnant women, and people with diabetes or conditions that weaken the immune system. In severe diseases, the infection can spread to other parts of the body, and in serious cases, prolonged antifungal medicine is required. All right, and there are some preventative measures to prevent catching coccidiomycosis. First, coccidiomycosis is not contagious. In rare cases with wound infections, there is the ability to spread valley fever to someone, but the occurrences of that is very rare. Infection can also be spread through organ transplants with an infected organ. Traveling to endemic areas. Risk of infection through travel is low, but be mindful of very dusty settings. Avoid areas like construction or excavation sites. Stay inside during dust storms and close your windows. Air, air filtrations, measures indoors, and clean skin injuries with soap and water to reduce chances of developing skin infections. Reinfection, more likely for those who suffer from severe cases, disseminated to another organ in the body. And what would you do if you've been exposed? You should contact your healthcare provider and follow up with medication and treatment regimen if given. In healthcare treatment, to diagnose it, they have the serology test, and there are two types of serology tests. First is the enzyme immunoassay test, which detects specific IgM and IgG antibodies against coccidioides, and the complement fixation or CF, which detects immunoglobulin G antibodies and allow assessment of disease severity. Culture, they take tissue and respiratory specimens, and for treatment depends on the severity. Um, Normally, if people that are normal and are healthy usually does not need treatment, but if you are one of the people that are highly susceptible to it, you may be given antifungal meds to get rid of it out of your body. Medications include fluconazole, voriconazole, and amphotericin B for serious or life-threatening fungal infections. And hospital admittance, severe lung infections, or infections that have spread, and valley fever that develops into meningitis can be fatal. And for Healthy People 2020, Coccidiomycosis was not part of the Healthy People 2020, but is reportable in certain states. Um, State health departments collect information about cases of valley fever and then send the information to CDC through the National Notifiable Diseases Surveillance System. Weekly, all right, and that should be it. And here are the some of our reflections that we reflection and some lessons that we learned from doing this project. I have gained many valuable information from this project that I could teach other people in the community, since I personally knew some people in my city that struggled with the disease. It is important to get checked when symptom persists and not wait until last minute so that care would be provided to avoid complications.
All right, after doing this presentation, I have learned that we should be aware of the disease in our community. And since I did my paper on this topic, I gained additional knowledge on how this disease may mimic other disease processes as well. Since we live in the San Joaquin Valley, this is a really good topic to teach our community.
And then from this project and my own struggle with valley fever, I've come to understand the phrase health is wealth. It's very important to implement healthy lifestyle habits, such as simple changes to your diet and exercise to prevent compromises to your immune system that later will lead to more serious health problems.
And this is our presentation about coccidiomycosis. Thank you so much for listening.
Thank you.
Thank you.